Welcome everyone to our statewide model programs of study in health science and technology. We are now going to get started. I'd like to thank my panelists for joining me here today. What you see here on your screen is the agenda for today. We're going to start with a welcome from the Illinois Community College Board, sponsors of this kind of statewide model program of study in coordination with Education System Center. We're going to provide everyone attending a background on the model programs of study guides and how they have kind of ties to statewide policy alignment and kind of how they originated and were created with the role of an advisory committee. We're going to walk all the attendees and all the participants through the model program of study mapping process and kind of then deep dive further into the programs of study guide in health sciences and technology. We're then going to have an opportunity to hear directly from the programs of study in action in the Chicagoland region with City Colleges of Chicago with my colleague Peggy Corrales, who will introduce herself later in the presentation. And we'll also kind of culminate this with some opportunities for you all attending for feedback and next steps. For those of you who may be joining in a webinar with Education System Center for the first time, or who have kind of maybe joining this programs of study process for the first time, we highly encourage all of you as attendees, because this is a webinar, we highly encourage you that you use the Q&A feature and or the chat box feature in the session. Some of my colleagues are going to have an opportunity to respond either in writing in the chat box, respond to your questions, or we will take opportunity to pause through the presentation to make sure we address those out loud as well. This webinar obviously is being recorded and we're going to be bucketing it and kind of slicing it up for more broad dissemination. And the slide deck that you're going to be seeing here today will be linked throughout the presentation in the chat if you wanted to kind of click on some of the hyperlinks that are available and kind of digest it more further, or if things on your screen appear small. But obviously everything else will be, for all registrants of the webinar, everything will be packaged and sent to you all via email as well. So thank you all very much for your time, and let us get started. First, I want to introduce Janelle Jones from the Illinois Community College Board for a few words.
Thanks, Juan Jose. Good afternoon, everyone. I'm Janelle Jones, Director for Career and Technical Education at the Illinois Community College Board. And on behalf of the ICCB, I would like to welcome everyone to the Illinois Model Programs of Study Guides webinar series, which is, of course, kicking off here today with the health sciences and technology. We here at ICCB are very grateful to partner with EdSystems as they facilitate this very timely work around programs of study. I know many of my post-secondary colleagues are currently working very hard to develop and submit programs of study to ICCB for approval per the Perkins 5 reauthorization ahead of fiscal year 2023. So these model programs of study guides are extremely important because they serve as excellent examples to adopt or modify for local programs of study, especially in terms of the secondary to post-secondary connection. So I just want to thank you, say thank you to EdSystems for your continued partnership. I also want to thank all of the individuals who participated on the advisory committees for each of the published model programs of study guides. The robust membership on these advisory committees really demonstrate the stakeholder representation and engagement that's necessary to develop quality programs of study. And finally, I just wanted to say, as EdSystems continues to offer professional development, demonstrate exactly how the models can be used in program of study development, ICCB highly encourages everyone to connect with EdSystems. Additionally, please continue to attend this webinar series. I know we'll have the dates coming up soon and all the other professional development opportunities offered by EdSystems. And with that, I'll turn it back to you, Juan Jose.
Thank you, Janelle. So I will kick it over to my colleague, Jonathan Furr, to lead us through the following slides.
Thanks, Juan Jose. Good afternoon, everyone. I'm John Furr. I'm the Executive Director at Education System Center at NIU. We're really pleased to be able to partner with the Illinois Community College Board in supporting the model program study work. You've had a chance to meet Juan Jose already. Also wanted to introduce Megan Mitchell, who's our new Pathways Manager and is going to be supporting the work with colleges and districts around this space as well. So again, we're thrilled to be part of this effort and to be with you this afternoon. So I'm going to start off just by introducing you to Education Systems Center. For those of you who might not be familiar with our organization, our work is focusing on shaping and strengthening education and workforce systems that can advance racial equity and also prepare more young people for productive careers and lives. And our focus areas are around college and career pathways. You'll be hearing a lot about that today. We also do extensive work around bridges to post-secondary, which includes both early college credit and transitional courses and other efforts to avoid remedial outcomes for students, as well as data. And we engage in that work at the statewide levels. We're working with the Illinois Community College Board, but also through a number of community networks and different strategic initiatives in support of these efforts. One thing that I'll say is certainly as we dive into the model programs of study, I think you'll see those connections from pathways also to those key issues of bridging secondary to post-secondary. And we'll be talking about data as well when we talk about some of the labor market goals that we have for this work. So in terms of this first segment, I just want to provide you with general background on model programs of study and what their purpose is and what they're trying to achieve, and some of the statewide frameworks that have gone into the development of the model programs of study. So Janelle had talked about this before. These really are, the model programs of study are intended to serve as models. So our goal for the work and the goal for the development of these guides over the past few years is to provide guidance and exemplars for local programs as you're really doing the hard work to adopt and to customize these for your program of study approval for the Perkins 5 plan. So again, think of these as resources and supports for your local work. One of the key areas of focus, and we're going to talk about all the analysis that went into this process, is to be able to identify what are those priority dual credit and early college courses that should be sequenced across programs of study from high school into post-secondary. So you have those connection points and are able to accelerate students from their high school coursework right into those post-secondary programs of value. We also go beyond courses and begin to speak to competencies. And that was some of the work of the advisory committee, was to dive into the competency sequences across the programs of study. And we also hope this work can help you to engage with employers so they can begin to understand where to connect in with your coursework and related student experiences. So in terms for the audience for the model programs of study, really that we have always viewed these guys as being most useful to high school faculty, certainly working in pathways, both administrators and the teachers engaged in this work. Also critically, community college faculty and staff with deans and department heads, early college liaisons that are also building out the programs of study, education for employment system directors that are supporting the high schools as well to implement their CTE programs. And we have done this in many virtual rooms where we've worked with these stakeholders and taken the model programs of study and helped to facilitate conversations to benchmark their local programs against these guides. And that's kind of what we're hoping some of the outcome of this work will be, that these can be as a starting point for local conversations amongst the audiences there. And generally, we do feel like these model program study can be adapted for student and for family-facing resources, but it's important to start to make sure that you're documenting locally those models kind of based on these statewide programs. So we are starting here with health sciences and technology. We have other presentations teed up in the sequence you can see there on the slide. So please make sure that you're signed up and we'll make sure to continue to push the information out so you have the opportunity to engage in similar presentations in other fields. So as we talk about the model programs of study, they're all generally based on a framework for pathways, which has been developed across agencies over the years. This framework is reflected in the state's Career Pathways Dictionary, which is a resource which is out there that we can also provide out to you all. But generally, as we talk about pathways across multiple agencies, it starts with those 4 components on the left-hand side. So as we talk about pathways, students need to be engaged in a planning process to understand what are their career goals and how am I able to get there. There's also the need for that career-focused instruction. So the sequence of courses in areas like health science and credential programs that are helping to guide them along that career path, but it goes beyond coursework and needs to be integrated and tied into work-based learning experiences. So students can really experience what it's like to work in the field of these various areas. And last but not least, you have to embed the core academics, right? So students need to be able to have those English skills, those math skills, the aligned science coursework that's necessary for success across these programs. And then programs are sequenced not just in one area in high school and post-secondary, but across secondary and post-secondary, leading to credentials and labor market goals for the various regions. And there's an important component in our state framework the college and career pathway endorsement, which can signify that a student has met key milestones in their high school experience on the way to completing a pathway. So to dive in a little bit more deeply into the college and career pathway endorsement, and there's a lot on this slide, it might be kind of hard for you to see, but again, we'll link this out and provide this as a resource. The state has established a system for high school students to earn a college and career pathway endorsement, but when they graduate from high school, based on their completion of the components that are shown on this slide. And these 4 components tie into those 4 elements of the pathway that I just had shown before. So there is the expectations that students have that plan for where they're going and that they're engaging in a series of work-based learning experiences or professional learning. We're not going to dive too deeply into the professional learning sequence within this presentation today, but we do have a separate set of webinars and resources on work-based learning that we will make sure that we're providing out to you and we'll talk about later, where if you want to really dive in and to understand work-based learning sequences and health sciences pathways, we have resources for that as well. Much of our focus is going to be on these last 2 components, a career-focused instructional sequence, which the expectation for a pathway endorsement is that a student would have at least 2 years of coursework within that career-focused sequence, and that they would earn at least 6 hours of early college credit, which again can be either as dual credit, as advanced placement, as articulated credit or proficiency-based credit within that sequence, and that students are also demonstrating readiness in English and math for transitions into post-secondary through either early college credit in those coursework or through transitional courses or through other multiple measures developed with their community colleges. So the College and Career Pathway Endorsement Framework is tied in very heavily across multiple state policy areas, including the CTE work and the Perkins 5 plan. It's derived from the Post-Secondary Workforce Readiness Act, which was also the act that established the system for transitional instruction within our state. As you look at the Model Partnership Agreement for dual credit, it prioritizes courses that are part of a college and career pathway endorsement as part of the funding and the procedural aspects for that. It ties into the state's work around the teacher workforce, within the ESSA plan for school districts and the state's economic development plan. So it's very cross-cutting, and that's why it's kind of used as a foundational component as we think about the model programs of study work and the other efforts that we're engaged in here. And from a student perspective, to really boil down what's in that pathways policy framework and what that means to students who have gone through a pathway process means, first of all, it starts at that very foundation, that base of the pyramid, that they have foundational skills for all careers, right? So regardless of the direction that they're moving in with their career goals and their post-secondary programs, that they've built those employability and those entrepreneurial skills that will allow them to succeed in those various paths, and that they've been able to develop that through work-based learning experiences, through real-world activities that are reinforcing that work. Secondly, though, and this is really important, especially as we're thinking about high school students that are beginning a pathway, is that they are accelerated towards a career area. So that's kind of the middle layer of that pyramid. Let's see if we can get that text, but there it comes, that students have engaged in multiple years of coursework that begins to show their commitment to that field. And if students decide to continue on that post-secondary path, they are accelerated on that path. If they make a different decision, well, they're better prepared to make that decision as well. We often say that college is a very expensive career exploration tool. If we're allowing students to be able to engage in that understanding of their career in high school, they're going to be better positioned to make those decisions as they move into post-secondary. And our framework around acceleration toward a career area goes beyond that traditional CTE sequence, but also gets into the other industry credentials and gen ed courses that are needed. And last but not least, the top of that pyramid is making sure that students are academically ready for college, that they've had access to college level coursework through early college, and that they're also demonstrating that readiness in those core subjects. So that's kind of what this is all about. It's easy to get lost in the minutiae and the details, but what we're trying to promote are students that are ready for these elements for these different layers for the pyramid. So this is reflected, those frameworks are reflected throughout the work around the model programs of study guides. And over the course of the last 2 years, we've worked to be able to build out guides in these 8 different areas that are shown here. And these 8 areas generally align to the 16 national career clusters. So that's crosswalk, we've done it, that's out there, but these are more like a meta major approach, these different pathway areas. So we'll be talking about the health sciences space today. Again, there are other guides that are out there for resources, and we're actually looking at over the course of this year, might we be able to develop a few more guides in some specific areas that we don't feel are covered by these current 8. And the last thing that I want to be able to touch on, and Janelle talked about this as well, is that when you look at these guides, and the importance of this work is that they were informed by a broad-based advisory committee between 25 to 30 folks. You can see their names and toward the end of each of those guides that include representatives from school districts, from community colleges, from 4 years, from employers, from other stakeholders in these different industry areas. That were able to help advise on what are some of the trends in the industry that you can't just see from looking at Department of Labor or Department of Employment Security labor reports. What do they begin to see as credentials that are starting to emerge as being really promising within the field? You know, we were doing a lot of really deep desk analysis, and Juan Jose will show the spreadsheets and all the other work that we've done with this, but we needed to make sure, how does it relate to what's happening on the ground? And getting that voice about the perspectives, about the reflection of the on-the-ground realities, and thinking about what are the future of work considerations we need to be having in terms of jobs that might be automated, jobs that are impacted by COVID, other trends that we're starting to see within the field. And as part of that work, they really were engaged at key points in that process about defining the pathways map, thinking about selecting those strategic early college credits, and really, really deep work around identifying the competencies that are sequenced as part of these pathway models. So again, we're excited to have you along with us today. And with that, I'm going to turn it back over to Juan Jose to really talk in depth about the mapping process.
Thank you, John. So to launch our mapping process, what you're seeing here on your screen is kind of the 5 major component parts of our creation of the model programs of study. This was generally like a 6-month process with our advisory committee, from initial kind of desk research through the launch of the advisory committee process, edits, changes, and even public comment period, right? So this was a very robust process. Many of you might have been a part of it or even kind of significantly influenced. So we thank you all who have chimed into creation of these guides, and looking forward to additional feedback over time. I'm going to be focusing on the first 2 sections, which really go hand in hand and in tandem in the creation of the guides, right? The identification of high priority occupations, which is a definition in the model programs of study guides, and kind of the notion of a promising credential or stackable credentials, which are also referenced in the guides. So in the model programs of study, when we were thinking about how to create kind of the right courses or the right strategic early college credit courses, we first really had to determine what were the right occupations to benchmark our pathways and to benchmark our programs of study too, right? And then from that step, that would influence everything else that went forward, right? So in order to do that, we started off by using kind of this notion of a high priority occupation, an occupation that had positive growth in the state of Illinois over the next 10-year period as a percentage or as an absolute number, or occupations. And we also looked at, and it was not or, but it was an and. We really focused in on occupations that had the potential for a living wage salary at its median, right? We wanted kind of to benchmark our pathways to occupations for how to have a living wage for one adult, one child. And that was all based on kind of the MIT's version of the living wage calculator, and the occupation growth was based on the Department of Labor and kind of the Career One Stop webpage as well. From those occupations, we then kind of defined a promising credential as any degree, college certification. They immediately prepared you for that high priority occupation, right? We focus on occupations that were achievable or could be accessed to and through the Illinois community college system. So that didn't over rely us on bachelor's degrees, and it didn't steer us in the direction of like third-party providers or private sector providers, right? We were focused on the Illinois community college system and the degrees and credentials, certificates that were typically available there, or that typically stacked, meaning that they built towards another promising credential that was also placing into a high priority occupation. Now, this is just a preview or a snapshot of how the analysis went in some of our advisory committee meetings. What we would present to our advisory committee is kind of a list of occupations per kind of program of study area. We would link to those occupations. As you can see here, when you click on it, it pops up another screen. We would kind of this was a snapshot of the Department of Labor data at that time, which showed kind of the median salaries and the median wages for some of those occupations, the growth over time, and what it typically took to get started in that profession. And then using kind of some of our agreed upon definitions, we would then kind of indicate which occupations were a total green light, meaning that they were definitely to be included and to be benchmarked in our programs of study, which ones really we needed further discussion and kind of debate among our advisory committee, and those without a doubt were kind of generally kind of left off the programs of study or, not benchmarked to when selecting programs and courses. And this was kind of dictated our first section of our approach. We then looking at the promising credential aspect of this, right? What we took those occupations and those professions, and then we linked back to kind of the programs that were typically offered at various community colleges, right? And those programs or those kind of degrees either include Associates of Arts, which would transfer to kind of bachelor's, Associates of Science, or then we also looked at Associates of Applied Science, Advanced Certificates, subspecialties, and we also thought creatively as for example, in the finance and business sector, we included supply chain degrees or supply chain logistics, and thought that really fit nicely into kind of the finance and business sector. And we did this throughout kind of other career areas as well, thinking creatively, what should legitimately be placed in this programs of study area. We also want to note that we also paid attention to the Illinois State Board of Education and kind of their designed and funded programs of study matrices for secondary districts. And we wanted to make sure where we saw overlap and kind of collaboration or corroboration between the two matrices and the guides as well. I will leave it to my colleagues to flag for me when I need to pause to do something in the chat as well. I want to move on to kind of some of the meat of the programs of study, the real heart and soul of the guides, which is the identification of strategic early college courses and kind of the impact they had on the guides. So once we had determined which were the proper set of high priority occupations, promising credentials, we then kind of narrowed in on those programs and looked at all the courses that were required for those certificates, for those degrees, and kind of just simply tallied and labeled all the courses to see which courses either appeared most common or most frequently, which of those courses were accessible either for dual credit, accessible meaning there was a high likelihood of student being able to be eligible to take the course, or accessible in the sense that a typical high school might be able to kind of offer the course by credentialing a high school instructor as adjunct faculty. We also heavily paid attention to the ability of courses to have transferability and portability, either through Illinois Articulation Initiative or through other kind of partnerships between community colleges and universities. And whenever possible, we would highlight or overlap what industry credentials were integrated into various kind of community college courses. For example, in manufacturing, some courses were aligned very directly to MSCC or NIMS credentials, and so on and so forth. This is just kind of a snapshot of a spreadsheet that shows kind of what the advisory committee would view when preparing or thinking about the slides, right? This kind of desk research would just simply, as you can see, what it simply shows, and I'll try to zoom in, is it would show kind of the name of a course, the course title, what it was called at a particular community college, and what it might be called at other community colleges as well, called common name. We would try to list out prerequisites for those courses, and then we would just also tally the times it appeared at various community colleges programs or sequences, and kind of try to make note of, is the course a door opener, meaning would it allow you access to other courses, or was it a prerequisite for other courses? This is just showing you kind of that back of the house research. This is not ultimately what gets published, but just to show that this work really contributed a lot to the analysis. Moving on to our next section, which is the real kind of the hardest part. What was the hardest part of the analysis and the development was mapping a secondary to post-secondary sequence. It was in our experience the realization that many times secondary school districts and post-secondary institutions had a lot of familiarity with mapping and creating course sequences and structures, but they were always very much happening in silo, right? Secondary institutions were creating their own sequences. Post-secondary institutions were doing theirs, and not often enough were they creating a unified secondary to and through post-secondary that included community college, bachelor's program, and industry credentials. So that really became the most important part of our programs of study guide creation and a lot of our focus. When creating this secondary to post-secondary sequence, there were certain guiding principles that we really focused on with the advisory committee, negotiated, and always kept coming back to, right? So we wanted to recommend early college courses as reasonably accessible to high school students. And the goal was to get at least 6 hours or more of early college credit. That 6 hours or more of early college credit in the career focus sequence, if you recall, ties back into the college and career pathway endorsement and is a direct alignment to that framework. When creating a secondary sequence, we also kept open the possibility for unique opportunities, such as work-based learning, a cool capstone course, or maybe an apprenticeship or things of that nature. We always had in mind the kind of typical teacher or high school faculty or the college faculty credentials and what was typically required to become an adjunct faculty at either high school or post-secondary institutions. And with the era of COVID, we also kept in mind kind of the new developments in course delivery and approval processes that were happening in many of your institutions. We would suggest an initial post-secondary set of courses and sequences that would be accelerating a student, and we will alter and edit through our advisory committee process. Finally, one thing that we also did, which was I think unique to our process, which is we made a set of recommendations in the quote unquote general education subject areas that included early college, dual credit, but also AP or advanced placement, and how they fit into the students' kind of course schedule, and how those like general education like science, social science, English and math courses could either augment or complement the pathway sequence. Last but not least, we also spent some time focused on competencies. And while the college career pathway endorsement creates a set of competencies for each industry area or each endorsement area, what we went in this case is we went deeper on a set of competencies on select courses. We chose courses that were highly, that we found to be highly strategic in the programs of study sequence, but were not already portable or transferable through the Illinois Articulation Initiative, right? So I'll highlight some of those courses in the kind of showcase of the health science programs of study, but we looked to see which credentials were associated in these courses, could they be accessed for early college credit, and we created a set of technical competencies for each course, requesting syllabi from various institutions, from high schools, community colleges, in some cases even four-year universities, and looking for a set of commonality and kind of frequent learning outcomes and objectives for all these courses, and synthesizing into a set of competencies as well. I'll pause for a set of questions or comments if people have on the general process and before I deep dive kind of the program study sequence in health science. Great. I see a question here about helping to problem solve. At the end of the webinar, we will have an opportunity to for you to fill out a survey and request additional support in your local region to facilitate some of those problem solving conversations. It's something we look forward to, and it's something we're excited about to partnering with you all as well. Now, the next part of the guide, what you're seeing here on your screen now. Oh, go ahead.
Sorry, Juan Jose. I think Megan was trying to talk, but we can't hear you, Megan. I see Maria Rosa, one of our attendees, has raised her hand. Maria, not sure if I'm going to set you, allowing you to talk if you want to ask your question. No, I don't see Maria. Well, Maria, feel free to chat to the hosts and panelists, and hopefully we can help you out. Thanks, Juan Jose.
Thank you, Sarah. What you're seeing now on your screen is kind of the complete visualization of the model programs of study in health sciences. Obviously, there's a lot on your screen right now, so we'll deep dive some of the component parts in alignment with our kind of framework and process that we showcased earlier. Oh, thank you, Maria. Great. So as we stated, the first thing that we focused on for the programs of study was the kind of selection of high priority occupations and wages and occupations. You see that snapshot here in the health sciences framework. Footnotes and citations are at the bottom of the screen. And what we generally thought was in health sciences, it really could be divided into three or four areas, which is, there was this one like pre-professional track, right? Which listed here as pediatricians, but it's really about anyone looking to do something that would require a professional school after a bachelor's degree, right? So doctors, dentists, optometrists, that kind of pre-professional track was something that we included in the programs of study and would help with some of those districts who were really trying to recruit students who were college bound or kind of four-year university bound into pathway development. The next big section of the guide or occupations that were coming up often was obviously around nursing, registered nurse programs, practical nurses, certified nursing assistants, and those are in the middle section of the guide. I do want to make note that nursing assistants were not near or above the living wage threshold, but were reasonably considered as a stacking or kind of preparatory experience for the other higher end nursing occupations should a student pursue them. There was a lot of programs at many community colleges around surgical technology, medical and laboratory technology, respiratory therapy, physical therapist assistants, which ended up being very high earning occupations and were really much benchmarked in our guides as well. This is not an exhaustive list, but it's really trying to emulate kind of some of the typical occupations that were happening at any kind of given community college in Illinois. And there was also a lot of programs around dental hygiene and dental hygienists. Those programs were then kind of sequenced or linked to their post-secondary degrees or credentials, and kind of showcasing how a student can go at the post-secondary level into each sector, and how that kind of can lead to a community college degree or industry certification, and or transfer to kind of certain bachelor's degrees or other university institutions, right? So in the case of, for example, registered nurse, you could earn the credential solely through kind of a community college, or you can also take your Associate of Applied Science or your Associates of Science and continue that work on into a registered nurse bachelor's degree, which is kind of frequently happening as well in our current labor market information around nursing. Many of the other professions, such as like radiological technology, respiratory therapy, now mostly culminate with an Associate of Applied Science and allow an individual to start working and get started there as well. There have been some developments since we last published a guide around medical laboratory technicians and technologists. Our home institution of Northern Illinois University has created a transfer program for AASs in medical laboratory technology. So if we were to make updates to these guides, or if folks from Northern Illinois or community colleges partnering with Northern Illinois, we would welcome your suggestions and feedback on how we can alter the guide for those sections as well. I do want to kind of focus in at the moment now on the career focused courses and the kind of the bread and butter of the model programs of study. You'll notice, first of all, that there's certain symbols here that are, the legend of the guide is not visible, but I did want to highlight some of these symbols when you print out the guide or when you have it in front of you, refer to dual credit courses with I&I articulation. Some of these mean industry certifications here by certified nursing assistant. And then there's the reference to the college career pathway endorsement as a little ribbon here at the top. The model programs of study guide in health sciences starts with the orientation or introductory level, right? Now, when we talk about orientation, skill development, and capstone, we're not so laser focused on a specific year or semester within a high school student experience. We're trying to talk about grade bands or grade situations, right? So we envision an orientation introductory level as something between 9 and 10. And in that space, we really recommended students take what is frequently offered in many high schools, their high school level introduction to health science, introduction to orientation to health occupations, health occupations introductory skills development. These are courses found frequently in the Illinois State Board of Education CTE program of study matrix. And there's sometimes opportunity to overlap these courses with a college equivalent, but that wasn't frequently done or available in our program of study. Moving on to the skill development phase. I did want to highlight that this is kind of where the advisory committee really started to earn its participation trophy, and we really thank them for that, right? One of the courses that we saw frequently pop up, or often enough pop up, was medical terminology. More importantly, that course frequently did not have high barriers for student accessibility, right? Some institutions might have required English 101 for that course, but many did not. So that became a very accessible course for students to kind of take as an initial dual credit. And it overlapped with kind of a course in the secondary program of CTE matrix as well. So we highly recommend that students start off their skill development or expand on their skill development in health sciences with medical terminology or some form of that at your local community college. We also found that there was a frequent course that came up in a lot of programs that we looked at, which was anatomy and physiology. Many community colleges offered two versions of anatomy and physiology, one of which was a single semester version, and then there was also a 2-semester version offered at many community colleges. If many of you read the program of study overnight or before, you'll notice that we're referencing the single semester version of anatomy and physiology. There was a lot of debate in our advisory committee about whether to reference the 2-semester or the single semester version. What we ultimately kind of settled on was allowing access to anatomy and physiology as a single semester would prepare a student well for kind of taking that course again as a 2-semester sequence at their post-secondary level, and some high school districts were doing that as well. I must note that anatomy and physiology is not as accessible as we would like it to be, right? It many times required an English 101 requirement or placement for students to access that, or the threshold for an adjunct faculty to teach that course was high at an Embed community college level. So we often, and made reference to in our program study guide, to the notion of dual enrollment, or what is now in the language of the model partnership agreement, dual credit model B. Correct me if I'm wrong, John, which is like the student takes that course at the community college campus or through a community college faculty advisor, adjunct faculty as well. That may be happening virtually now, which would be like type C or something like that.
Right. And there's one question, what Juan Jose just want to pose. There's a question about to what extent these courses would be transferable if a student decided to pursue a bachelor's degree from a four-year university.
Yeah, so medical terminology and anatomy and physiology did not exist in the Illinois Articulation Agreement, so they were not inherently transferable, right? That being said, it was a little bit of a case-by-case basis. Some community colleges have articulation agreements with many post-secondary institutions. So that would be a little more ad hoc. Those two courses, however, medical terminology and anatomy and physiology, became the courses that we highlighted for competency development, and created a set of competencies and portability kind of statements for them, such that if we ever developed a process for their articulation, those would be the ones we recommend, and maybe even have something prepackaged as well.
Great, thanks, Juan Jose. I also just wanted in the chat, there is one of the affirmations from Sauk Valley about they have the intro course in anatomy and physiology and that 2-sequence course. So I think that is something that we heard from many colleges around the state.
Great, thank you. Now at the Capstone experience, although some may argue and kind of advocate that anatomy and physiology could be as a Capstone experience as well, we allowed the flexibility in the Capstone to highlight certain very kind of high value work-based learning opportunities. And that was really kind of what we focused on in our model programs of study sequence, right? We wanted to encourage the individuals to do something like a certified nursing assistant course offered many times at community college, a pharmacy technician course or program, or any other course similar to that would lead to an industry credential, right? Potentially, I don't know, phlebotomy or kind of patient care technician, right? Or an EMT, right? These high hours, high college credit courses, we wanted to definitely recommend as something that would really introduce the student to the sequence. I want to finalize here at the post-secondary level. We always try to make recommendations about what the student should be taking. What we felt is if a student is enrolled at a local community college and they started down an Associates of Science or an Associates of Applied Science sequence and if they have taken some of the courses to the left, they should just continue the sequence. If they have not, take some of the courses listed here as your kind of first year courses as well, because they are still highly valuable and strategic. Even if they're not dual credit, they will still launch this person into that post-secondary sequence. The next part of the guide that I want to highlight is the general education courses that we highly recommended and kind of some suggestions of work-based learning that are unique to health sciences. So what I really wanted to focus on was the science sequence. As you can imagine, in health sciences and technology, science would be the most important sector. So we really wanted to focus on biology and chemistry as a general best practice. That symbol there that you see, the two triangles, means dual credit or advanced placement, right? So our guide is early college neutral in the sense that whether the student earns that credit as dual credit or AP, it's equally valuable and strategic. The point is that the student earn the credit in that sector and in that coursework because it will prepare them for post-secondary work. At the post-secondary level on the far right-hand side, we listed some courses that were typically available and would be the natural next step in some of these sequences for student and health science. I did also want to make note that in social science, we strongly recommended psychology, once again, as AP or dual credit, and if not taken, kind of doing so in your first year of post-secondary as well. Obviously, in almost all guides and in all sectors, we always recommend students take English composition or English 101 or transitional English so that when they get to post-secondary, they are ready for college level coursework and some of those introductory courses such as psychology, such as biology, general chemistry, anatomy and physiology, so on and so forth. In math, there are many opportunities and many chances for students to fulfill their math placement requirements. So we kind of listed all of the ones that we felt were valuable in this space. So if you are implementing a transitional math at your high school or in partnership with a high school, if you're a community college, we highly recommend statistics or transitional math and statistics in this kind of programs of study sequence. But if possible, and the student can get higher kind of credit, we recommend pre-calculus, calculus, and general education math if a student can take those for early college credit as well. Now, I wanted to kind of finalize here with the strategic dual credit course competencies. As I mentioned before, we developed competencies for medical terminology and anatomy and physiology. If I can zoom in here, what you'll see here, an example is for each sector, we kind of did a theme. So like a section of which was commonly occurring in various kind of syllabi. So here on the left, we see that many syllabi in medical terminology had a section about building and defining words. And they also had a section about like anatomy and body structure. And then for these two themes, we had a set of competencies that we felt appropriately and kind of properly summarize the trend happening statewide for these courses and the competencies the student should display coming out of this course. Now, I want to take a break from speaking and really kind of showcase the most important and fun part of this presentation, which is these model programs of study in action and in implementation. And for that, I'm going to turn it over to our colleagues at the City College of Chicago, Peggy Corrales and Siobhan Taylor.
Thank you, Juan Jose. Hello, everybody. My name is Peggy Corrales. I am the Associate Vice Chancellor of High School Partnerships with the City Colleges of Chicago, and I oversee the implementation of a really large partnership agreement between our two institutions called the Chicago Roadmap. Siobhan, do you want to introduce yourself as well?
Absolutely. Hi, everyone. My name is Siobhan Taylor Booker. I am City Colleges of Chicago's District Director of Early College Programming, and where I oversee dual credit opportunities for our students.
Awesome. Okay, so I'm going to just tell you just a little bit briefly about the Chicago Roadmap, which is what we consider our umbrella of lots of different things that we're working on with the Chicago Public Schools. But the Chicago Roadmap is an overlap of strategy between CPS and CCC, where we're working collaboratively to create more and better opportunities for students and to break down institutional silos that have always existed and can be hard to sort of break through. You can go to the next slide. So we hired a consulting firm, Education First, to do a lot of research and to really look at the landscape, how it is currently. They analyzed a lot of data, both from CPS and city colleges. They held focus groups, they did interviews, they talked to philanthropic partners, community partners, teachers, students, faculty, and they created a really detailed report that outlined 8 strengths and 12 key challenges. And the strengths are really focused on things that we had been already collaborating together on successfully, such as early college and the huge growth we've made there, and also our STAR scholarship and some other things like that. But really looking at the 12 key challenges, we used those challenges to create what we now call the Chicago Roadmap, and took a look at these challenges and broke them down by domains and identified 9 strategies, 9 game changer for equity strategies, which is what we call them, to really give us a blueprint of what needed to be done in order to significantly change the landscape for Chicago students. You can go to the next slide. Oh wait, I think we skipped a slide. Oh.
It seems to not be there at the moment, Peggy. I'm not sure why.
Okay, no problem. I'll just quickly talk over it. Essentially, I was mentioning the 5 domains of the Chicago Roadmap. And so each domain represents a bucket of work. Like, for example, the first domain is academic readiness and success. And the second domain is access to high quality programs. So this is the domain that these model pathways really sit in. And our game changer for equity strategy with this domain is this creation of high quality dual credit pathways in wages and high wage, high growth sectors. And so implementing model pathways has become our key focus for this domain to really give students these new and better opportunities at CPS and aligning to pathways at city colleges as well. Okay, now we can go to the next one. So using the model pathway that EdSystems has created, we kind of customized it as they recommend for our particular institution. And so for students in grades 9 and 10, it can vary slightly at each school depending on the courses that they have. They do, either CPS, CTE coursework, intro coursework in health, or they can do a CCC 102, which is our Introduction to Health Career Studies program. But we get right into, starting in grades 10, this Bio 120, the medical terminology that Juan Jose has been talking about. One of the great things about this course for us is that there are no prereqs for students. So there was no real gatekeeper keeping students out of this course. The problem came in with it being hard to credential for faculty. Our credentialing guidelines, and it's something that we're hoping to look at a little bit more closely, but there are a lot of credentials required in order to teach it. And so we were having a hard time getting faculty credentialed at CPS to teach this course. But I'm going to tell you how we problem solved for that in a minute. The next course is the Bio 116, the Intro to Anatomy and Physiology. And we're lucky because the only prereq for this course is successful completion of Bio 120. So if we can get students through that Bio 120, they can go directly into Bio 116. Another way into that course is also to be English 101 eligible, but it's not required if they've taken that Bio 120. And so that seems to be the way that we are able to push students in there, because to be English 101 eligible at the 10th or 11th grade can be really, difficult for a lot of students. And so having that other avenue to get in that course is really great. Then it leaves students with their senior year with some options. One of the options is this BNA sequence. So we have a 10 credit hour BNA sequence that students can take during their senior year. We're also aligning this pathway with our career launch efforts, which is a program that we're building with CPS to create youth apprenticeship opportunities for students. So during senior year, students can be placed in a youth apprenticeship in the health industry. And there are also other options for programs that lead to industry recognized credentials, such as farm tech and things like that, that are also options for students during their senior year. And the great thing too is that the courses, Bio 120, Bio 116, and even the BNA, those are all prerequisite courses for applying to our nursing program. And Bio 120 and Bio 116 are foundational courses in a lot of our healthcare pathways. So students having completed that at CPS gives them the opportunity to have lots of options. It doesn't push them necessarily in only one path, but gives them lots of options when they come to city colleges to pursue careers in health. Okay, I'm ready. So as I was mentioning before, the Bio 120 can be hard to credential. So the pandemic actually gave us an opportunity to think creatively and outside of the box. And I really credit Siobhan here, who is our director for early college, for helping to launch our pilot into this new Model C, which is like Model B, but only it's virtual. So it's city colleges faculty teaching courses to CPS students virtually, synchronously and virtually, which is different than an online course, because you log in at a certain time, the class was from 1 to 2, and the teacher is there teaching live, but virtually. And so, the pandemic gave us a great opportunity to pilot this. We piloted Bio 120 from students from these schools. And this has been sort of like a game changer, because it can help problem solve for schools that don't have qualified faculty to teach it. And also for small schools where there's pockets of students, but not necessarily a full class of students who want to take this course. So you can teach, one faculty can teach this course to multiple schools at the same time, which is really a game changer. And I added, that we were able to offer Model C in some other disciplines as well. And a lot of schools were able to have dual credit for the first time because of this new way to access the course. Siobhan, I didn't know if you wanted to jump in here and say a few words about how it went overall.
I do. Thank you so very much. As you can see, you guys, I'm very excited about this. It went well. We did have some challenges. One of them was that we had a need to communicate not only with our CPS instructors, our faculty, but the students more efficiently than in person. For a very long time, we only focused on Model A dual credit and Model B dual credit. And so Model C required that our communication would be more timely because we were not in person. And so what we did was we leveraged intelligent agents through our learning management system. We used Brightspace. And so we created for every section, and we started with 4 sections of Bio 120 in the Model C format. We leveraged intelligent agents, and what those automated emails did for us was rallied and maintained a high level of support and engagement for those students so that we could get the support needed so that they could be successful. So we're excited about the network enrollment implementation that we created for the other types of courses that are some, IAI approved, and we're going to sustain it and move forward in this space. Thank you.
Thanks, Siobhan. Okay, we can go to the next slide. So once we had our model pathway sort of, identified, and we decided as a team, as the Chicago Roadmap, that we would begin with the healthcare pathway to launch. So last year, CPS really concentrated on finding schools who were ready and willing to launch this new healthcare pathway. And so we're happy to say that it has launched at 8 CPS high schools this year. I've listed the high schools here. It's Chicago Vocational, Dunbar, Gage Park, Instituto Health Sciences, Juarez, North Grand, South Shore, and Washington high schools. So you can see that this is really a variety of the types of high schools, the sizes, the kinds of students that they serve, and really ranging across the city as well. And so, we're excited that this has launched. 124 students have started in this pathway this fall. We're expecting to onboard 135 more in the spring. And they're starting with the Bio 120 and then moving into the Bio 116. So yeah, we're excited about that. It just launched.
Peggy and Siobhan, there's a couple questions in the Q&A that I think you guys can definitely answer, and they're actually really excellent. So the first question is, what is the cost of Bio 120 for students taking it for dual credit, or kind of how do the logistics of student costs play out? And we'll start with that first.
Siobhan?
Yes, our dual credit program is at no cost to the students. We ask our high school partners to cover the cost of textbooks. So that's the partnership agreement we have with Chicago Public Schools. Residents of the city of Chicago does not have to pay for the course itself.
The next question is, what steps are taken to ensure equity among students in CPS to be able to take Bio 120 dual credit course?
The Bio 120 was actually launched as a citywide opportunity. So every school received the opportunity for enrollment to ensure that every student had the opportunity. It wasn't selective in a sense. When we piloted, it was open for every student. So a high level of communication went out to both the schools as well as the students. So we have several programs here in the city that are actually citywide initiatives.
And I just wanted to address that too, that, the roadmap was developed with an equity lens, and we're looking at our game changer strategies to really focus in on specific equity goals that we've established. And so the Bio 120 fits nicely because, number one, there are no prereqs, which could be real gatekeepers for students in terms of entering in the course, but also that we're able to offer this new way of accessing the course through this virtual Model C. Because what we have seen is that small schools, especially a lot of the small schools in Chicago, are located on the south and west sides and have majority African American students. And a lot of time those small schools with a small number of faculty, they don't have the flexibility in their schedules to add new courses or may not be qualify for the dual credit. And so we're seeing as a real equity move to be able to offer dual credit courses in this way. And for schools that might not necessarily have an entire class of students who qualify, but handfuls of students who qualify for other courses as well.
I'm seeing a question now about.
Yes, Susan?
Yes, do CPS high schools all run on the same bell schedule? We're in a rural community and 18 high schools have different schedule, making it difficult to synchronize all virtual courses.
Absolutely, absolutely not. No, I don't know if there's 150 high schools, not one of them, no bell schedules match. So I feel you on that. You know, you have to sort of look and say, okay, you know, we're going to run the course from this time to this time and have schools sort of work it out. Like if it's adjacent to a lunch period, they can leave lunch a few minutes early and start, and you know, that sort of thing. But you have to, it's a challenge. To say
I want to supplement to the answer as well. In addition to what Peggy just mentioned, so yeah, the schools don't have the same schedule. So we have a strategy for that as well. Most of our synchronized Model C classes actually have the same start time that's built into the high school schedule, meaning we start these classes after 2:30. So you're looking into the early evening, afternoon at the junior and senior level for students to have some face-to-face time with the professor, and then some time that is asynchronized too, where they're working on their own. The synchronized time is after 2:30. So that's how we were able to kind of rally all of the students and then kind of meet the needs based on the different schedules and then the different after-school activities as well. So this class actually met with the instructor at 4 p.m. I hope that helps, Susan.
Great. There's a question here about, for our college, we have experienced lower persistence rates in A&P, and it is known to be a very difficult course. Are you concerned about pass rates for this course, particularly as the lab will be done by synchronously rather than in person? I will answer that. I will kind of take a first stab at that because there was some discussion in our advisory committee about A&P being a difficult course. And then I will definitely pitch it over to CCC to kind of their firsthand experience as well. So yes, A&P is very difficult, and many times the lab part was increasingly difficult, right? The advisory committee ultimately still felt that the course would, even if the student got like a C or a B, it would properly prepare them for the rigors of what they would be expecting and experiencing at the post-secondary level. And at the certain level, it would be really introducing that student to a course that they would have to get through for post-secondary for many of the degrees and pathways. So it really became a really unique and confirming or rejecting course for students about whether they wanted to be in that profession, in that pathway. So because of that aspect of the course, it had a high value despite the difficulty. But I'll pitch it over to CCC as well.
So yeah, I wanted to thank you for that. So you know, Bio 116, we just launched the pathway now, so students are in the Bio 120. And what we're going to do, we're getting ready to launch our dual credit course teams. So we're assembling course teams of faculty from CPS and from city colleges. So like for Bio 116 and Bio 120, where the faculty will collaborate together to create high quality course materials specifically for dual credit courses. So looking at what high quality materials look like at a course, you know, on campus, and looking at what are some, you know, needs in the teaching this course in a high school, and creating these really high quality materials that can be standardized across Bio 116, you know, all the schools that are going to offer the Bio 116. So our hope is by putting that work in now, we're going to help sort of the delivery of Biology 116, looking at the scaffolding that's needed for these courses, looking at assessments, and then being able to keep these course teams going to look at student assessment results and looking at the data to say more is needed here. We need to beef up the curriculum in this space and sort of work collaboratively as a team on those courses. So that's something that we're getting ready to launch by October. We're selecting our members now.
Siobhan, do you want to talk about the aspect in the chat about kind of student athletes or band members or anything like that as well regarding some of the virtual courses?
Yes, excellent question. And as I mentioned before, we initially launched the pilot to include the FaceTime or synchronous instruction at 2:30 to be built into the high school student schedule. When we shifted to the 4 o'clock, everyone in the program did not participate in after school programs or any other, auxiliary or, specialized programs. But that still didn't mean that we would have that need moving forward. So what we're going to do as we, live out this fall semester and the rest of this academic year is every student will have an autonomous asynchronous day built into their program so that if they have a specialized, practice or rehearsal, they're going to use that particular day to meet the demand of their high school schedule and activity, and then do their autonomous asynchronous learning with that respect. You have to get really creative with, doing what works for your area. So we've been fortunate to have students on the pathway that didn't have a whole lot of the after school, but we are prepared for those in the future who will.
Thank you so much. There's a question here in the Q&A, and thank you for this. A question about a lot of my high schools seem to be gatekeepers on who gets into the class, even though I do not have prereqs. I'm assuming this question is coming from a community college faculty or person, right? For instance, a student has to have certain high school courses completed before taking the course, or the high school says you have to have a certain high school GPA. This needs to be affect the equity goals we are trying to achieve. For the person who kind of asked this, like, you're absolutely right? And what we would really encourage is definitely to say that, like, encourage or invite those districts into a conversation about what is the inherent value and the strategic value of not only dual credit generally, but of strategic dual credit for pathway completion and for accelerated kind of advancement at the post-secondary level, especially for those students who are normally tracked into what is called like vocational education, but are not prepared for post-secondary and for career education simultaneously. So we invite you to kind of maybe have us come out to your college, talk to your faculty, talk to some of your high school partners, and kind of not only deep dive what is the inherent value and purpose of dual credit, but how some of those requirements that they are putting on are actually not embedded in any state law or statute, and it might be somewhat arbitrary, but they might, recognizing that there might be a legitimate reason from the high school side to have those prerequisites, and we can maybe kind of balance those out over time. And sometimes the solution is just a pilot with a certain set of students and loosening restrictions and learn from that and go on and keep going forward.
I just wanted to add to that, we have certain criteria that we look at too for entrance into early college by looking at attendance rates and GPAs. But our workaround is if a student doesn't meet one of those thresholds, they can get a letter of recommendation from their counselor or their principal to say that although the student doesn't meet these thresholds, we still think the student is a good candidate for dual credit for these reasons. A lot of times students may have a horrible freshman year or may have a horrible freshman and sophomore year, but then have turned things around by the time they're juniors and seniors and be a lot more focused. And so those letters help a lot of students who are sort of in that situation get access to the opportunities that they are now ready for that maybe their GPA doesn't reflect.
Wanted to kind of highlight some of this next development. Sorry about that, Peggy.
Yeah, no problem. This is just sort of our next steps. We're really excited about launching the model pathway in the health sciences. And we have more pathways that we're working on. So we have like the development phase, the incubation phase, and then the implementation phase. So our healthcare model pathway is an implementation. It's our only one that we have right now in implementation that we just launched. We are preparing to launch our IT pathway, which has 3 separate tracks, and also an advanced manufacturing pathway that we're preparing to launch in the next fall. So fall 22, fall 22, FY23. And we're developing right now a construction technology or a master builder program pathway as well. That we're really excited about. And so, we see this as a great way to get more students in these high quality pathways and to give them access to dual credit, high quality courses that they can then, move into the community college or give them a much better outlook in terms of what they are interested in or maybe what they aren't, but either one is valuable.
Now, we'd like to kind of pick it over to Megan Mitchell for kind of culminating our feedback and kind of survey response sections. We have about 10 more minutes for this webinar, so we really thank you all who have joined us, but we have 10 more important minutes. If you can just push through to the end with us, that we really appreciate it.
Megan, you're muted. So,
Sorry. Sorry, we're not able to hear you, Megan, but I can maybe pick it up briefly for a second.
Okay.
There you are. There you are.
You can hear me? Perfect. All right, so we've gotten a lot of content today. And so I want you all to take a moment to look at these concepts that are here at the screen. And so use the chat box, right? And so I want you all to jot down in the chat box something that's still circling in your mind, a concept that squares your thinking, and then up to 3 takeaways that you can utilize and really take a deeper dive into. So I'm going to give you a moment to kind of gather your thoughts and just kind of write some things in the chat box.
Thank you, Catherine, for sharing that. It's helpful to know.
All right, Carrie, absolutely. Pilot C is very interesting, right? Great share, love that. Other thoughts that you all would like to share in the chat box? Again, something that's still circling in your mind, something that squares your thinking, and up to 3 takeaways. Thank you, Siobhan, I appreciate that. I see a question here about, or comments, particularly about getting access or getting a list of high priority occupations updated. Juan, do you have an answer to that particular question or comment about that?
Yeah, I think if that's something that we should be updating, or if you have strong suggestions around that, we definitely encourage you. We're going to have a survey linked to this webinar. Definitely encourage you all to kind of maybe make note of that, or because we're using these this deep dives to then kind of encourage feedback in a survey that might lead to a revamp or alteration over time.
Thank you. Anna, thank you for your comments in terms of how dual credit offerings can contribute to equity. Absolutely. I'll give it about maybe 30 more seconds if you all want to add to the conversation. Thanks, Katrina. These guides, were definitely done with intent and a lot of thoughtfulness.
Cynthia, yeah, I've definitely noted that, but definitely kind of highlight which careers in particular you feel might be missing, because and then we can definitely circle back about how to integrate them and what does the labor market include for them. So please submit that feedback. We welcome it.
Yeah, and also just know that there were some trade-offs thinking about a statewide model, but part of the work that we can help you is to think about what is a customized local model, where there may be other programs and careers that should be highlighted based on your own regional program efforts.
All right, Juan Jose, if you could advance the next slide. All right, so we have a survey, right? We want to get more information from you. I'm also going to drop the link in the chat. If you have a phone, I would encourage you to just kind of go ahead and go to your camera and just toggle along the screen, and then the survey should automatically pop up. If not, go ahead and click on the link that you see there. And so this is so important to us because it kind of helps us get an idea of, one, how you're going to implement the model programs of study guides. And then two, we want to know how we serve you in this moment. Like, we want to know how this webinar was able to give you the information that you needed to be successful. And then lastly, as you heard earlier in the presentation, John Furr talked about us exploring more model programs of study. And so we want to get some feedback about those guides as well. Can you advance to the next slide? All right, so upcoming webinar. So this was the first of many webinars that we're going to host. You all should have already received this information via email, but we'll definitely send it out again. These are a list of all of our upcoming dates and our guides that we're going to take a deeper dive, just like we did today. And then next slide, lastly, we talked about those creations of our new guides. And so the three that we are potentially exploring are human and public services, not education, culinary and hospitality, and then lastly, transportation, distribution, and logistics.
And then lastly, I'll speak to this page. We mentioned that for those of you looking for more resources on work-based learning, this would be the place to link that as well. So if you see here on the top left of your screen is a link to the iWin Resource Hub. Our colleague Heather Panzeg does a great job of collecting, documenting, and hosting a webinar series about work-based learning implementation in the state and how that complements some of the curricular stuff, which is more the model programs of study. So for those of you really at the kind of EFE level, high school level, or even at the college faculty level, looking for a way to kind of embed work-based learning more into the student experience, we really highly encourage you to subscribe to our newsletter or kind of to join our Illinois work-based learning, visit our resource hub and kind of be a part of our monthly processes and webinars as well for that. I am linking the slide deck here in the chat box, because then you'll be able to go to this slide and then click on those resources as well. But as you'll see here, this is our Illinois Work-Based Learning Innovation Network. And we normally have our latest webinars, specifically, we have our latest webinar, Health Science, Work-Based Learning Implementation, which was done just yesterday. And this webinar is currently on our webpage for you to kind of complement that with the webinar you just heard here today. So with that, we want to thank you all for joining us. One more time, a link to the survey. And I want to thank all the panelists from City Colleges of Chicago for joining us. Janelle from ICCB. This was a really wonderful opportunity to share with you all. And we will keep the Zoom and webinar open for those of you who might have last and burning questions. But if not, for those of you, we'll give you back 15 minutes of your time. And thank you once again.